Medicine has seen significant advancements over the years, from the invention of early diagnostic tools like the stethoscope to sophisticated imaging technologies like MRI scanners. In recent decades, digital technologies have played an essential role in this progress, changing the way we understand, diagnose, and treat patients. Virtual reality and augmented reality are now at the forefront of this digital revolution, allowing medical professionals to visualize, interact with, and better understand medical data. These technologies don't just enhance current practices. They open up new possibilities for diagnosis, treatment, and training, helping to make healthcare more accurate, accessible, and engaging.
While VR and AR are distinct technologies, they are closely related and often work together to improve medical outcomes. Virtual reality creates a fully immersive, simulated environment, ideal for training, where professionals can practice skills in a controlled setting. Augmented reality, on the other hand, overlays digital information onto the real world, making it valuable in situations where live interaction with the physical environment is essential, such as during surgeries or patient consultations. Together, VR and AR create a powerful ecosystem. VR offers immersive learning environments, while AR supports real-world practice by providing critical data and insights during actual medical procedures. The use of VR and AR in healthcare might seem recent, but these technologies have developed over the past few decades. In the 1980s, VR was first explored for simulations in fields like aviation, which paved the way for its use in medicine. By the 2000s, medical schools began using VR for anatomy lessons and surgical simulations. Today, VR is a common tool for training and research, while AR aids in surgeries and diagnostics by providing real-time layered information. One of the most significant applications of VR and AR is in medical education. Virtual anatomy labs allow students to explore the human body in an immersive 3D environment. This not only enhances their understanding, but also provides a more engaging learning experience. Surgical simulations are another area where VR and AR shine. Medical students and residents can practice complex procedures in a safe virtual environment before performing them on real patients. This hands-on training is invaluable for developing surgical skills and confidence. Case studies have shown that institutions incorporating VR and AR into their curricula have seen significant improvements in student performance and retention. For instance, the University of California, San Francisco, has successfully integrated VR into its medical program, leading to better prepared and more confident students. These technologies are also revolutionizing surgical procedures. AR-assisted surgery allows doctors to overlay patient data, such as MRI or CT scans, directly onto the patient's body during procedures. This provides surgeons with a more accurate and detailed view, leading to better outcomes. VR is also being used for preoperative planning. Surgeons can visualize and practice complex procedures in a virtual environment before performing them on actual patients. This not only improves surgical precision, but also reduces the risk of complications. Case studies have demonstrated the effectiveness of these technologies. For example, the use of AR in neurosurgery has led to more precise and less invasive procedures, resulting in faster recovery times for patients. VR and AR are also transforming patient care and rehabilitation. In pain management, VR is used as a distraction therapy to help patients cope with chronic pain. By immersing patients in calming virtual environments, VR can reduce the need for pain medication. In physical therapy, AR guides patients through rehabilitation exercises, providing real-time feedback and ensuring proper form. This not only speeds up recovery, but also reduces the risk of further injury. Additionally, VR is being used to treat neurological conditions, such as stroke. Virtual reality environments can help patients regain motor skills and improve cognitive function through interactive and engaging exercises.
The economic impact of VR and AR in healthcare is substantial, with projections showing rapid market growth and significant cost savings across the industry. According to Global Market Insights, the global AR and VR healthcare market is projected to expand from $2.85 billion in 2023 to $16.14 billion by 2033. Growing at a compound annual rate of nearly 19%. This growth reflects strong investment and rising adoption as healthcare providers increasingly see the value of these technologies. Beyond market size, these technologies are expected to make a major contribution to the global economy. A report by PwC estimates that VR and AR could add as much as $1.5 trillion to the global economy by 2030, with healthcare alone potentially contributing $350.9 billion to GDP. This economic boost is driven by improvements in patient care efficiency, diagnostic accuracy, and access to specialized treatment. Cost savings are also a major advantage. Research by McKinsey & Company indicates that VR implementation can lead to an average cost reduction of $5.39 per patient compared to traditional care methods due to reduced operation times, improved surgical precision, and shorter hospital stays. In summary, VR and AR are driving substantial economic growth in healthcare by reducing costs, increasing efficiency, and broadening access to quality care. As these technologies continue to evolve, their economic impact is expected to grow, reshaping both local and global healthcare systems. Enhanced training and skill retention. A study published in the Journal of Medical Education found that medical professionals trained using VR simulations exhibited a 20% improvement in skill retention compared to those trained through traditional methods. This enhancement in retention translates to increased procedural accuracy and confidence, leading to fewer errors in clinical settings. Improved surgical precision. Research featured in The Lancet. Digital Health demonstrated that AR-assisted surgeries reduced operative times by an average of 15% and decreased complication rates by 30%. The real-time visualization provided by AR allows surgeons to navigate complex anatomies more effectively, resulting in faster procedures and improved patient outcomes. Methodological advancements. The integration of VR and AR into medical practice signifies a methodological shift towards more immersive and interactive training environments. These technologies enable practitioners to simulate complex scenarios, practice procedures in a risk-free setting and make informed decisions during actual patient care. This approach not only enhances individual competencies, but also sets new standards for healthcare delivery, emphasizing precision and patient safety. In summary, the adoption of VR and AR in healthcare is leading to measurable improvements in clinical outcomes. By providing advanced tools for training and real-time surgical assistance, these technologies are transforming medical methodologies and elevating the quality of patient care. As virtual and augmented reality reshape healthcare, they also bring important societal and ethical questions. Who has access to these technologies? Advanced setups are often limited to well-funded institutions, potentially widening the gap in healthcare quality between regions and demographics. Data privacy is another concern. These technologies often rely on sensitive patient data, which must be handled carefully to maintain trust and compliance with regulations. There is also the potential for over-reliance on these tools, risking a reduction in traditional diagnostic skills. Establishing ethical guidelines and ensuring equitable access are critical for VR and AR to benefit society as a whole.
The future of VR and AR in medicine promises even more innovation. As these technologies integrate with artificial intelligence, we can expect personalized training modules and data-driven AR overlays that adapt to each patient's unique anatomy. According to research from the Mayo Clinic, AI-driven virtual and augmented reality applications have the potential to create highly individualized patient models, allowing healthcare providers to tailor procedures and training with unprecedented accuracy. However, AI's reliability in critical tasks like surgery remains questionable due to its black box nature and demonstrated failures many times. While useful for providing real-time patient data, e.g., temperature or vitals, AI in surgery poses ethical and safety concerns. In 2025, France, for example, banned AI in direct medical decision-making, prioritizing patient safety and human oversight. In remote healthcare, World Health Organization (WHO) projections indicate that VR consultations could become more common, connecting specialists with patients in underserved areas, reducing geographical barriers, and potentially improving health outcomes on a global scale. Furthermore, as costs decrease, studies from Allied Market Research suggest that VR and AR are likely to become more accessible to a broader range of healthcare providers, making it possible for these technologies to benefit society widely and equitably. This future is not just about advancing technology, but about refining healthcare methodologies to be more inclusive, precise, and effective. Implementing VR and AR in healthcare comes with significant challenges. High initial costs for technology and training can prevent widespread adoption, especially in under-resourced hospitals and clinics. A report from McKinsey & Company notes that the upfront costs of VR and AR systems are one of the main barriers to scaling these technologies across healthcare systems. Training medical professionals to use these technologies effectively also requires dedicated resources, as these tools involve unique learning curves Additionally, data privacy and security measures are crucial, especially as VR and AR systems become more data-intensive. According to the International Data Corporation, IDC, maintaining compliance with regulatory standards for patient data protection is essential to build trust. Without addressing these logistical and financial challenges, we risk creating an uneven healthcare landscape where only certain institutions can afford to adopt these advanced tools, potentially widening the gap in healthcare quality and access. These technologies represent a new era in healthcare, transforming methodologies, improving clinical outcomes, and posing questions about accessibility and ethics. As we move forward, it's crucial to address both the advantages and challenges these technologies bring. With responsible implementation, it can make healthcare more precise, efficient, and accessible. But to fully realize their potential, healthcare systems must strive for equity and consider societal impacts, ensuring that VR and AR technologies contribute to a healthier world for all.